All right, committee, welcome back. I trust you all had an enjoyable lunch. Based on some conversations on the current amendments and some of the work that might need to be done on white bagging, I'm optimistic that you'll all agree for the working group to meet another time or two and then bring an individual bill to the session in February. That way we don't have to have another meeting of this full committee. And it wouldn't be a committee bill, obviously, but we would certainly ask anybody on this committee who wanted to co-sponsor it as an individual bill to bring it forward. I think when we have fixed some of the amendments and have a better definition of specialty and what is a specialty pharmacy, or just rip that all the way out of the bill. I think there's some disagreements in the community about how to move forward that's best going to work for Wyoming. And there is no, I think, immediate need, but it is something we need to address in the upcoming years. So to lay it back, I guess that would be certainly welcome at this time, Co-Chairman. Oh, Senator Hutchins, do you have a question before the motion?
Yeah,
Sure.
is that your final decision or can I make a motion?
Senator Hutchins, well, technically, if I called on you to make a motion before I called on Senator Baldwin, you could make a motion to put the bill, well, whatever motion you wanted, yes. But I'm probably gonna defer to Senator Baldwin first, if that's okay.
You can.
And then if his
defer me,
motion goes
but-
down, then we'll go from there. Senator Baldwin.
Okay,
Well, thank you, Mr. Co-Chairman. I would make the motion that we lay this bill back pending some meeting of the interest group or the stakeholders group at least once, if not twice. And then this be sponsored as an individual bill for the February session. But I would propose this time we lay it back pending that action and not further consider it today.
Second, all those in favor of the motion, say aye.
Aye.
Opposed, say no. Let's have a show of hands. All in favor of the motion, raise your hand. 1, 2, 3, 4, 5, 6, 7. That motion will pass today. And we're almost back on schedule then. And committee, I will say the next working group meeting we will set up and you will all be invited. It will assumedly be in Casper probably. And in about a month or so. And we may even have 2 of them. So I'll make sure everybody on the committee is aware. And if you would like mileage and per diem and perhaps salary, I'll check with LSO on that to attend and enjoy more white bagging. You're certainly welcome when we get a date set for that. All right, with that, is Jen back? I don't see her quite yet. Well, let's talk about what's next on our agenda? Is it EMS? Well, we'll just skip ahead to. Yep. Oh. Welcome, Ms. Davis from the governor's office. Perfect timing. I know you might want 30 seconds to get situated. You're good to go. That's what we appreciate about the executive branch. And so thank you, committee. I know this came on the agenda in the last couple of weeks. We did have the governor's task force on EMS here 2 weeks ago. Senator Hutchins and I attended. And it was a 6-7 hour meeting where we went through a variety of options on what the future of EMS is in Wyoming. And so Jen Davis from the governor's office is here to kind of present how that meeting went and maybe some recommendations for this committee. Welcome, Ms. Davis.
Thank you. Good afternoon, Chairman and members of the committee. I'm Jen Davis, Governor Gordon's Health and Human Services Policy Advisor. I wanted to just, excuse me, sorry. Wanted to just go over, as Chairman Zawanser mentioned, the recommendations that came out of the small working group that we had put together a few weeks ago. As you all know, this has been a big topic over the last couple of years. You guys have been hearing about it during the interim. And we also have had an EMS subcommittee that has been meeting for close to the last 2 years of looking at what some of the issues are with EMS and then some possible solutions. So what we did a few weeks ago was really took some time to look at what are some of the big priorities? There's lots of issues that we could tackle in EMS, but really trying to narrow down what could we do now that would really help set the system up for some success moving forward. So the proposal that the recommendation I have today is not the end all be all for sure, but we all think that it's a step in the right direction where we can help stabilize the system a little bit more over the next couple of years. So what we talked about was a variety of options at looking at how can we leverage fire, EMS, our emergency response across our counties who oftentimes are working in tandem anyway. So what we would like to propose is that we talked about doing an appropriation of $5 million that we could then support local entities of coming together collaboratively to look at what it is that they need in their local areas. We had talked about options of kind of defining those areas. It's really difficult to do that because there's so many different factors in play. So this opportunity that we're talking about would allow groups to come together. Maybe it's multiple counties, maybe it is in one county, fire and EMS together. It could look different in each area, but they could put forward a simple application to get some support from some grant funding that would allow them to hire somebody to help coordinate their efforts. So we had initially talked about doing some stuff on the back end about maybe after they tried to do a district from the legislation that was passed. But what we have heard pretty loud and clear from the local areas is that they just don't have capacity to get there in many of these cases. As you all know, many individuals in both fire and in EMS are volunteers. They don't often have administrative support to help coordinate meetings, pull people together to have the conversation about what really are our needs and how can we put together a funding plan that would actually meet their needs of, still supporting their volunteers, but also looking at can they add on paid workforce as well. So this would give them the opportunity over the next 2 years to hire somebody to help support that effort and pull everybody together. The additional funding that would remain after that would be they could do a second application after they have a funding plan in place and be able to get some implementation support to get things off the ground. We hope this would accomplish a couple of things. One, encouraging groups to come together both in fire, EMS, emergency response coordinators throughout our counties, and really just have a conversation about what are our needs, what do we have, what are our current costs. I think we don't always have all of that information because the system is so different in every location. So this would give an opportunity for them to do that, and I think put some transparency in the system to really see where we're at. I think the other thing this does is through that transparency process, it really helps us to better understand what are the true costs of EMS in our state. And then after they have the opportunity to put together their funding plan, maybe run their ballot initiative for a district, then we might have a better sense of what is the true gap that is still remaining to make that system whole and sustainable across the state to have those services available. So that is what we would really like to think about. The main thing that we focused on in the group, the number one priority was the sustainable operations and workforce. The other thing that I want to mention, and this will even be news to Chairman Zwanitzer, I just got the text earlier this morning. We have been approved to put forward an application for EMS workforce through the WIP initiative. So what we are looking at in that is that we will offer slots to EMT basic, EMT advanced, EMT intermediate, and paramedics. I don't know what the funding amount will be yet. Those are still some details that are being worked out. But what we'll be able to do is cover the cost of their education so that we can get more people into the workforce, especially since we have so many of these individuals are volunteers. This at least will give us an opportunity that they won't have to incur a cost for their education by using these grants to then hopefully, at least while we're figuring the other components out, come and volunteer within these organizations, and in some places probably have some paid opportunities as well. So those are some of the two main things that we are recommending. Luke Seifert here from the EMS Association put out a survey to really find out what is the workforce need. It came back much higher than what we had anticipated. So that's where we'll kind of figure out with the funds that are available, how many slots we'll be able to open in each of those different areas based on the need that came back from the agencies that responded. So that is where we were thinking after our meeting. We had a really great meeting, lots of robust conversation, really complicated system, but really wanted an opportunity to be able to come in and support the system and really try to have the opportunity to help the locals help themselves by putting together this opportunity for them to hire somebody to help coordinate their efforts. So happy to take any questions that you all might have.
Senator Baldwin, go ahead.
Thank you, Mr. Chairman. Just a quick question. I'm just reading through the email you sent us, and I apologize for missing the meeting. I don't know what I was doing, but I'm sure it was very important. And that is, it talks here about areas will be able to apply for additional funding, and talking about local areas developed solution. Who do you anticipate when you say areas, and I'll use my area as an example, what coordination do you foresee? I mean, we're talking 3, maybe 4 different counties. What do you anticipate as being the areas, and who do you anticipate being the one that applies?
That's a really great question, Senator Baldwin. What we anticipate is we'll have to develop the application process for that based on what we want to see. The things that we've talked about is we want to see coordination of fire and EMS. Doesn't mean they have to combine, but they should be talking so that they know what the need is in a defined area. What we determined after our last meeting is that we couldn't really land on defining areas from the state level, that we really need to let the locals kind of define what that could be. So they can put together an application. Maybe it is, for instance, right now we have the Campbell County and Sheridan County effort where they just consolidated services. So they're serving 4 counties up there now under a consolidated umbrella. So that could be an application that would come forward and say, you know, we're all talking together in this area. We would like to hire somebody to help put our, a funding plan together, help us coordinate our efforts, see what our needs are, and then go forward. We could also have an area like Fremont County that is very large, and maybe it's just one county that comes forward and does that. Could also be something like Teton County where they have combined fire and EMS, and could be an application like that. So we wanted to leave it a little bit more open in defining an area, but with some things that we need to ensure that they're coordinating with all of those emergency response services within their area to do this. And we don't just want, say Burns to come forward and just say, we want a new ambulance. This is really meant to help coordinate an effort to bring people to the table and talk about what the possibilities are, where their gaps are, and how they could use this funding to really leverage, hopefully in some cases, putting forward the district that was offered in the previous legislation.
Let's go to Senator Dockstader and then we'll go down the line.
So how do these areas understand how to make application? Called an initiative, how do they, these smaller areas, I can see a Sheridan Gillette understanding how to work the system, but how do these little areas work it?
Chairman, Senator Dockstader, another great question. I think we will put that together in the application process about, what we're looking for in that, but then we will spread that out throughout the EMS and fire services using the EMS Association, using the fire system to get the word out to these smaller areas. Because you're right, there's some services that are really small. Lingle has an ambulance. So making sure that we get that distributed out to areas so that they know that that's available. But again, with the premise that we'd like to see them coordinating, we would hope to not see an application just from Lingle. But Lingle, Torrington, maybe their surrounding areas about how they all can work together.
Okay, and every county does have an EMT coordinator, well, an emergency management person in charge that you would hope you could utilize. Representative Ward.
Thank you, Mr. Chairman. Ms. Davis, maybe I missed it, but I don't think I have the email that you mentioned. Could you resend it?
Chairman Zwanitzer and Representative Ward, yes. I had just sent it to Chairman Zwanitzer and to Senator Hutchings since they were on that working group, but I will get that to all of you. Okay, perfect. Thank you so much.
Thank you, Mr. Chairman. You talked about funding sources for this. What is that funding source? Is it already available, and how much money is available?
Chairman Zwanitzer, Representative Hornock, we'll be looking to make a $5 million ask, and we'll put it forward as a budget request for this. And it would just be 2 years of funding. The hope is then, say an area puts forward this application and hires this coordinator, but if they'd like to retain that for their district or their region, whatever they want to call it, then they'll need to embed that into their funding plan that they're putting forward, because the funding that we'll be providing will end at 2 years.
Representative Hornock.
Thank you. Follow up, Mr. Chairman. So in the last just couple of years, I mean, I'm curious, the governor's office has received upwards of $300 million for various things in the budget that is specifically allocated. I'm wondering if the governor's office would be willing to use some of that funding and transfer it over, to provide this.
Ms. Davis, go ahead.
Chairman Baldwin, Representative Hornock, all of the money that came in under the ARPA has already been allocated. So all of it is already tagged for utilization through legislation that has been passed over the last couple of years. So there is not any available at this point. There may be additional dollars left. However, in having these conversations, how we are structuring this would probably not be eligible under ARPA because it isn't directly related to the COVID response. So those funds most likely would not be eligible to be used in that way. And so that is, we have injected some of the ARPA funding into EMS over the last few years that we talked about last meeting. There was funding that went in through ARPA. Some of that is still being determined if it's eligible through the AG's office. So it looks as if this concept would most likely not qualify under the ARPA funding.
Committee, further questions? Very quiet committee. They had a big lunch. Okay. Thank you very much, Ms. Davis. We appreciate that.
Thank you all.
Okay, let's take public comment on this. If anybody in the fire service, since we have a few of those people here, anybody wish to comment on that subject? I know they had a big lunch. Go ahead, come on up. I thought I saw you back there, but I wasn't sure. Go ahead and reintroduce yourself to the committee and welcome to Saratoga.
Thank you. Thank you, Mr. Chairman. My name is Luke Seifert. I am the president of the Wyoming EMS Association. We're grateful for the task force and the working committee that we had. I think that there's some important information that you should note about the data that we gathered regarding the workforce survey. So we had 20 agencies, which is about 50% of our transporting EMS agencies. Those 20 agencies reported that either now or within the next year, they anticipate a need for 224 staff. So if we just double that, some simple math here, statewide, if we anticipate 448 EMTs and paramedics of various levels as the need. That is 40% of the current workforce. 40%. So turnover rates are continuing to rise. Normally turnover rates are 20 to 30%, and we're seeing 40%. And so we are definitely in favor of the proposal that Jen Davis presented from the governor's office. We're hopeful that the WHIP initiative will provide training for those needed EMTs and paramedics. And as I sat back there and listened to Jen present and then some of the questions by the committee, I have a hard time as a Wyomingite sitting here and looking at the amount of money that our state spends and thinking that there's so much heartburn over $5 million or $10 million or whatever the amount might be, seeing as that is indeed the money of the residents of Wyoming. And so I would hope that as representatives of those Wyomingites, if you haven't heard from your constituents, that you might poll them and find out how strongly they feel about EMS and the need to support and sustain that system. We will certainly continue to press for them to reach out to you as well so that you can hear from those that you represent. And I would stand for any questions. Thank you, Mr. Chairman.
Thank you, Luke. And I just
Chairman.
throw a couple questions out here real quick before I look both ways. I'll look that way in a second. First of all, and I'm pretty sure, and I'm really not waving you off. I'm chasing a fly. You're probably fairly familiar with what's going on up in Sheridan and Gillette. If you could familiarize, I know Ms. Davis sort of touched on that, but can you tell us exactly what's going on up there? Because I think it's actually a pretty good study of what's possible in the state, if you could.
Yes, thank you, Mr. Chairman. So Sheridan had a private ambulance service and they were struggling. And so Sheridan Hospital reached out to Campbell County Health, another hospital system, and asked if there was a way they could provide EMS services. And so instead of Campbell County just coming in and providing services under their own name, they created an LLC, and the joint venture between Campbell County Health and Sheridan Memorial Hospital is providing those EMS services. So they now have ambulance provided by the joint venture of Campbell County Health and Sheridan Memorial Hospital, which provides that local buy-in and provides a lot of resources that hospitals are able to incorporate into the EMS system through the hospital system, like their HR departments and their training departments and all of the logistical support they're able to provide. And so that system, we've heard very good things back. I'm sure you've seen some of the press releases and news articles about that. And we've seen that in other areas as well. So Campbell County Health is a great example. We've seen that in Star Valley with Alpine, Thane, and Afton. We've seen that in the Bighorn Basin with Cody Regional Health. The Bighorn County Rural Health District and Washakie County. And so we see those popping up and occurring. And there certainly are cost savings and system strengths associated with those joint ventures and consolidations.
Thank you. I think that was good. And I would include their committee is that you hear Campbell County or Sheridan County, and you think of Gillette and you think of Sheridan, but when you really think about it, there's a lot of small areas that have really struggled for EMS service that are now incorporated into this much larger organization, or some of those small areas are not going to have coverage where they've really been struggling with it. And I know Senator Dockstader will relate to that, as we've done that in Star Valley as well, or I say they have. Go ahead. Senator
Well,
Dockstader.
that's probably one of the most successful things we did was team up the hospital. EMS volunteers were disappearing with the next generation. And we brought these folks on board and said, let's fly it under our North Lincoln Hospital District. Best thing that ever can when you talk about sharing personnel, responsibilities, all of that, equipment, ambulances. It was a good move. Not everybody can do that. So I'm not sure what the answer is there. I know we have, I call them black holes in between where he lives and I live. There's a stretch of highway that you go unprotected for a while. If there's a major accident, and it's a major connection between interstates in the Intermountain West, yet it's almost an hour plus driving of, I call it no protection land. It's very difficult. We need to probably start looking at that. As far as finding the money, in a state of 500,000 people, we're not taxing them for that. Oil, gas, and coal picks up the tab for all things Wyoming. And that's the way it is and will be for some time, despite the battles we go through. So we have to divvy up that money if you're looking for assistance. Or you have to find creative hospital districts like my own that said, no, we can sort this out with our existing funds and make it work. So just a thought there. Wouldn't you agree, Mr. Chairman?
Thank you. I saw a question down here, Representative. A question. Oh, well. Okay, then there is no question. Further questions, committee? See none. Thank you very much, Luke. Appreciate you coming down. Further comment? The fire group back there had a really very large lunch, and that's why they're not standing up. They're all gonna fall asleep here shortly. Mr. Boley. Oh, wait a minute. We got a fireman coming up. Thank you, Mr. Matthews.
Mr. Chairman, members of the committee, Byron Matthews, Wyoming State Fire Marshal. So one of the things that you talked about as far as regions and far as some of that discussion goes is an opportunity that we're moving forward with on our reporting system. So we're moving to a standardized reporting system across the state that'll look at fire EMS and our wildfire. That's going to give us the opportunity to analyze some of that data, identify those gaps, encourage those that participate or are adjoining those gaps, the opportunity to come in and work together as a collective. And assuming we come with this money and we build these regional coordinators, that's going to also build those teams in those areas so that we can figure out a solution that works. So we get away from any of those gaps or any areas that we wouldn't have services.
Questions from Mr. Matthews? See none. Thank you, Byron. Anyone else here in the, oh, Mr. Boley, that's right. He was on his way up. Go ahead, sir.
Thanks, Chairman Baldwin and committee members. Eric Boley with the Wyoming Hospital Association. And I serve on the EMS subcommittee with the governor's office. Just a couple of things. Yesterday, we talked about potentially having this committee send a letter to our congressional delegation to find a solution for our CNA lockout issue. One of the solutions that we need to get in place to help some of these rural EMS services and help them have the hospital cost-based reimbursement is there's a provision that the service has to be at least 35 miles from another service to provide services in those communities. So I'll use a good example. Glendo is 32 miles from Wheatland and 32 miles from Douglas. So either of those two ambulance services could provide services to Glendo, but they can't get the enhanced reimbursement because they're within 35 miles of that community and which puts them at jeopardy. So if we do draft a letter, I would just encourage, maybe this is another one of those where it's a great solution for a rural community. And I would also let you know that Senator Barrasso is interested right now in working on some rural solutions for our state. And so just some encouragement to maybe address that with them. The only other thing I'd say is Luke did a great job talking about what's happening in Campbell County. But in addition to what they've done with Sheridan, Campbell County themselves have branched out. I believe they're now providing EMS services in Newcastle. They've been contacted by Niobrara in Lusk to provide those services. I think before long, they'll probably have services in Moorcroft. There may be some opportunities for them as well in Crook County and up into Hewlett, but they've actually branched out further and they're providing services for a pretty long, big geographical area. So there's some good things going on. Thank you.
I think a geographical area roughly assimilates what we talked about in districts, if I'm not mistaken. I have to look back at our map, but it's fairly close. Any questions for Mr. Boley, committee? See none. Thank you very much. And with that, I will turn this discussion back over to my co-chair, who is back and refreshed and ready to rock.
Yes, I am. Then we're still on general EMS. Does anybody else wish to testify? If not, I believe the governor's office, I mean, if you need a letter from this committee or from the co-chairs, what I think is going to happen then, Ms. Davis, is somewhere in the budget appropriation process, the chief executive will make known to the appropriations committee this kind of funding idea and work before that committee. But certainly if you need, Senator Hutchins or I to come from the EMS working group, or the chairman and I are happy to do whatever you might need.
Chairman Zwanitzer and committee members, I think that would be great. I think this is important to the governor. I think it's important to many of you. And I think the more that we can collectively put that forward, the better. So if that is something this committee is willing to do, I think that would be very much appreciated.
Thanks. I'm not, that's my only concern is maybe the idea is not completely fleshed out enough on paper for us to have like a committee kind of agreement or a letter, but at the appropriate time, we can certainly send it out to the committee and kind of discuss thoughts on email or with the chairman, et cetera. And like that, we're at least moving forward with the direction is nice and helping communities help themselves, and because nobody likes the state down approach, I don't think is what we heard over and over.
Thank you, Chairman.
All right, yep, Representative Hornock, is it a question for Ms. Davis before she leaves?
Mr. Chairman, just a follow-up comment to my previous question, but just want to ask if the governor would be willing. What I was talking about was there was in the last session under, it was appropriated to the governor's office about $150 million under Section 321 for essentially trying to bring some industries into Wyoming. Those industries do rely on EMS service, that kind of thing. I would just ask that money previously allocated to the governor's office we might look at using that instead of increasing our state budget by $5 million, which, I mean, in the grand scheme of things isn't much, like was mentioned, but it is something. We do have money previously allocated to things that are, not in the norm for the governor's office. I think if the governor is passionate about providing good EMS service, I would just request and ask that that funding source be looked at to transfer money over into this, and that would be a much easier for myself as a legislator. That would be a much easier thing to look at as far as passing that kind of legislation when we've already got the money in place and maybe just reallocating some things. So anyway, just comment there. Thanks.
Any other comments? You'll take that message back. Thanks, Ms. Davis.
All right, thank you.
Okay, let's move on to firefighters draft legislation. So committee, you'll remember we had, I think, 6 or 7 options before us in Evanston that were originally proposed at our first meeting in Casper. A couple were not moved forward. I think we moved 3 different bill drafts to 2024, and then we held the following 2 bills for more discussion at this meeting. So first up, we'll do 24 LSO 24. Health insurance for volunteer firefighters. And I guess before then, we do have Mr. Cooper and Mr. Matthews on the agenda. If you just want to come forward, I don't know if you had any other kind of comments before we kick it off in regards to firefighters. So, and I'm not sure if either of you wants to present the bill. If not, we'll ask LSO to kind of quickly walk through it. And it's nice to have you close by. So there's 4 seats. You might as well hang out until we get there. Come on. Yeah. Lots of room up here. Anna, do you want to briefly run over 24 LSO 24 for us?
Yes, Mr. Chairman, members of the committee. This is 24 LSO 24, health insurance for firefighters. This bill draft allows volunteer firefighters to participate in the state employees and officials group insurance plan. They may enroll into the group insurance plan within 31 days of the enactment of this bill draft, or within 31 days of initially volunteering as a firefighter. Continued participation is limited to firefighters who may or may not receive compensation for services rendered as a volunteer firefighter, is carried on the regular rolls of a volunteer fire department, attends not less than 50% of the monthly volunteer fire department meetings, responds to not less than 25% of calls, and is not eligible for health insurance through a government-sponsored healthcare program. They also have to reside in the state. And then volunteer firefighters who enroll in the program shall pay their entire premiums and should not benefit from employer contributions to cover a portion of the cost of their premiums. And volunteer firefighters shall submit monthly verification of their continued volunteer firefighter status. There's a staff comment where I went over concerns from EGI that without an employer contribution requirement, only volunteer firefighters or their family members with health issues will end up enrolling. There were also concerns that people would volunteer as firefighters when they realize they have a major health issue in order to pay for expensive medical procedures. The committee may also wish to consider giving fire departments the option of covering the employer contribution. Pages 5 through 7 are conforming amendments, and then at the bottom of page 7, there's a rulemaking requirement, and then there's a split effective date. I would stand for any questions.
Questions for LSO and the mechanics of the bill? Not seeing any. Maybe we'll go right to our bench, Mr. Shat. Either one of you want to discuss? Nope, you're good. I guess it's all you, Shat. Welcome.
Mr. Chairman, thank you for having us today. Members of the committee, appreciate your time in beautiful Saratoga, Wyoming. Just here to support the bill. This will be the third time we've come before the committee to discuss it. We've had an opportunity to reach out to the Wyoming Fire Service and receive tremendous amount of support for the idea behind this, and we just want to try to work with our committee and continue to move this bill forward. So with that, I'm happy to stand for any questions, but just here to support it.
Any questions? What, could you say your full name and who you're with for the record?
Thank you. I should know better. Thank you very much. My name is Shad Cooper. I'm a fire chief for Suffolk County Unified Fire, and I'm the president of the Wyoming Fire Advisory Board for the Wyoming Rural Firefighters Association.
Excellent. And then did I see a question down there? Representative Yin.
Mr. Chairman, thank you. Shad, I wonder, I'm trying to remember what our previous discussion was like in Evanston, whether we should include volunteer EMTs or search and rescue, or whether we should leave it to just volunteer firefighters. If that makes sense.
If you remember, or Chairman Baldwin's happy to jump in, go ahead.
I'd be happy to jump in. And we did discuss that a little bit in Evanston. We talked about volunteer EMTs, and we did talk about volunteer search and rescue as well. And they are included on the retirement program, as you'll remember, those who were around, that we did include them on the retirement system. So I thought it'd be appropriate, and that would be an amendment I would offer as we get there. But we did talk about that in Evanston at some point. I don't know if there's any comments from these gentlemen.
If there is, go ahead.
Mr. Chairman, Byron Matthews, Wyoming State Fire Marshal. Yeah, and on that discussion, I think it's applicable that we look at that group. We look at that group currently under the same statutes for volunteer firefighter search and rescue EMT pension. And some of the language that we've moved into this legislation comes from that same bill. So I do believe that would be an applicable amendment.
Other questions? Questions, Representative Clouston?
Thank you, Chairman. How are those two groups, how would they meet the standards then for meeting attendance and training, or making, I think, is it 25% of the calls? Would they be up to the same standards as the firefighters?
Either one, I can certainly.
Go ahead.
Mr. Chairman, Byron Matthews, Wyoming State Fire Marshal. Yeah, so those requirements would be, they're the same requirements across, and that was part of this draft legislation. We brought the same requirements, so there was no differing expectations for any of the groups.
Think you're good. Any other questions? Okay, not yet. We'll have public comment if anybody else wants to come forward. I'm guessing Mr. Hayes will at some point. Anybody else on that side of the room wish to comment on this bill? Not seeing any. Do you wish to comment? Come on down, Ralph. Welcome. Floor is yours.
Mr. Chairman, members of the committee, my name is Ralph Hayes. I'm the manager of the Employees and Officials Group Insurance Program. I'm here basically to answer any questions you might have.
And of course, committee, because this is an interim bill, it has not been processed for a fiscal note yet. I'm not sure if it's appropriate, if there's any kind of internal numbers. You may have run preliminarily on what the fiscal to EGI might be. If that's fair to ask.
Mr. Chairman, members of the committee, really with a bill like this, you cannot judge the fiscal impact. I do have a fairly serious concern of adverse selection because the criteria for the employees is so different than the rest of the participating entities and employees out there who have regular hours they have to meet, whereby somebody can join the plan immediately just by signing up in there. And so an individual with a medical condition or maybe a dependent with a medical condition could join the plan to get something taken care of and be on it long enough to put in a short amount of premium, but receive a large fiscal impact. But I can't judge what that would look like. It would take experience and a look back period to judge that.
Mr. Hayes, would that be any different than any kind of state employee, someone, applying and getting hired on to be in state employment for insurance reasons and then whatever is covered, and then they resign 6 months later? Is there a real difference outside of this isn't an 8 to 5? People who are going to game the system could potentially go a different route into EGI, correct?
Mr. Chairman, there is some similarities, but this one is a lot different because the individuals are paying 100% of the premium. And let's face it, insurance is very price sensitive. So the individuals who would be attracted to enroll in the state's plan would happen to be on the older age categories who, let's face it, I'm in the older age category. Those of us who are over 50, and I'm well over that, we have a tendency to use benefits more than the individuals who are less than 50. So also when you're comparing it to the insurance marketplace, which is guaranteed issue on an annual basis, the younger folks can go on there and get a plan much less expensive than this one. So it really, shall we say, taints the pool, where with the state's plan for everybody else, there's a set employer contribution. It pays the majority of premium, 82%. And therefore, with that margin, somebody can't go out to the insurance marketplace and buy something cheaper. So we get the full range, whether they're 18 years old or they're 83, we get them all.
Representative Hornak.
Thank you, Mr. Chairman. I'm curious if there are any physical requirements for volunteer firefighters. Seems to me like when you think of those guys willing to, or people in general willing to be firefighters, they have to meet certain physical characteristics, which would kind of put them, in my mind, in a bit of a healthier category generally for individuals. I don't know if there are requirements to join a volunteer firefighter. I'm curious about that.
If you know.
Mr. Chairman, Representative Hornak. So I can't speak for every fire department in the state, but I can say different fire departments will have different criteria for participation. I can give an example, and in my own organization in Sublette County, we do an annual physical for all of our firefighters. We have a medical director that evaluates the results from that annual physical, and there's components with a blood draw and a physical exam and an actual work capacity test. And at the results of that, our medical director advises if the firefighter needs to be restricted or has full ability to go into what's a OSHA defined term, an ideal age, immediately dangerous to life and health environment. So we have medical protocols in place to make sure that we're using the right personnel to do the right jobs, but it's not a uniform policy that would be a statewide application.
Further questions? Representative Penn, looks like you're reaching for the mic. Go ahead.
Thank you, Mr. Chairman. Could we include in this, so right now I think they have to be a volunteer for 31 days, I think is what this bill says. If we decided to extend that, maybe that's a possibility, but also could we say, a member or volunteer for X time frame and has passed a physical fitness exam would then be eligible for the state plan? Would that, something like that be a possibility?
Mr. Hayes.
Mr. Chairman, members of the committee, a waiting period is not out of line. For instance, we have, as part of our workforce, part-time individuals who basically temporary employees who go through a longer waiting period, which is 90 days before they're eligible for the plan. But the way our eligibility rules right now, it's first of the month following joining the plan. So if somebody were to become a volunteer firefighter on, let's say, September 30th, they would be effective assuming we receive the application on October 1st. It's backdated. That's according to the plan.
Representative Clouston.
Thank you, Mr. Chair. You know that to your point there, I mean, volunteerism, I don't think it's 40 hours a week, so hopefully this fits into that part-time category. These volunteer firefighters, if they're injured while performing their duties as a volunteer firefighter, are those injuries covered under workman's compensation?
Mr. Cooper.
Mr. Chairman. Representative Clouston, yes, the volunteer firefighters are covered by workers' comp and contribute to that cost.
Follow up.
You know, just knowing the nature of the duties they have to perform, and knowing that we could be online for workman's comp injuries, not knowing what their past health has been or previous surgeries. I mean, I would highly recommend that we do some type of pre-test, offer them the job, but there should be some type of screening, in my opinion, that they have to pass before we're going to put them at risk or put our workman's compensation fund at risk.
Wouldn't you agree? Sure.
Well, how do you feel about that?
Thoughts?
Mr. Chairman, Representative Clouston, we have a presumptive legislation that addresses workers' comp and coverage. And I believe there's some language in that that might be relevant to the question. I can't cite it from memory, but I do think there's some room there to work that would address your concerns.
So, Mr. Cooper, I am slightly concerned with the mechanics of the bill. Whoever gives health insurance to a member, they can sign up immediately, but you do have some provisions. They have to do at least 25% of services and calls. And I guess my thinking is there probably is going to be an audit at some point. And I don't take this wrong, but I think we could all agree some of your volunteer associations are probably better at record keeping and bookkeeping than others. Is there any concern? We certainly don't want anybody being accused of insurance fraud. And so there is probably a stronger onus on each of those volunteer departments or on the county emergency coordinator, whoever it might be, to ensure a pretty solid bookkeeping system of how many calls are coming in, who responded, and should it come back and say, there were so many calls, this person didn't take them. Why are they still being offered insurance? I don't imagine we would charge a volunteer fire or EMT with insurance fraud, but it does concern me. Does that concern you or Mr. Applegate next to you, apparently, on those kind of requirements that are perhaps more stringent and require better bookkeeping than currently exists? And welcome, Mr. Applegate. Always good to see you.
Thank you, Mr. Chairman. Lanny Applegate. I've been involved with the fire service for 48 years this year, so I've been around for a day or two. I'm also on the volunteer fireman's pension, and I've been on it for 23 years. And for accountability, the Wyoming retirement system, they have internal auditors, and probably every 4 or 5 years, every single department in the state's going to get audited. Some's going to get audited 2 or 3 times because it's a random computer deal. And there's at times different board members, including myself, we've heard complaints about different departments not being up to snuff, and I personally have requested different departments to be audited to make sure that they're meeting their quotas. Wyoming retirement is not for somebody to just go in and jump through a couple hoops. They've got to earn that. And so that audit's done, like I say, by Wyoming retirement, every month, a different department is audited, or several departments, I should say.
So you think the record keeping is pretty strong now throughout? I know that's in volunteer firefighters and you're on mill levies. I mean, I think that exists I'm just not sure that exists in the EMS world, but that does exist in the volunteer. I'm talking myself into it as we go. Because all the volunteers are on a mill levy, which is currently accounted for, and you have to do a yearly audit.
Mr. Chairman, to kind of continue you talking yourself into this, as Mr. Applegate pointed out, yes, those are participating in the pension, which is where these requirements, so the language is identical. So those participating in the pension are currently participating in that same record keeping and accountability system that's being audited by WRS. One of the other things, like I mentioned earlier, was the overarching moving to one records management system will also give us another step of accountability if so chosen to verify that information.
And I do apologize. I know I keep saying volunteer EMS and this is just for firefighters. Any other questions? Representative Ahern, and then we'll get to Senator Hutchins.
Thank you, Mr. Chairman. We're trying to fix the volunteer shortages, correct? And you guys have done a lot of studies. How many people is this going to draw in and fix? Is this going to fix a portion, and what portion is it going to fix on the problem? Thank you.
You know, or can guess.
Mr. Chairman, Representative O'Hearn, to answer your question, we won't know until we try it. We want to, share this statewide and try to encourage our firefighters to sign up that need it. But right now, the way the language is they can't be already insured, and this. So, within my own organization, many of our firefighters already have health insurance through their primary employment. And so there's no way that we would be able to provide that estimate to answer your question. I can say that when we did our survey, we distributed statewide, we had, a 50% response rate. And of that response rate, the number showed that we were about 500 firefighters short in the state. So there's definitely a strong need to, provide incentives and recruitment and retention, benefits for our firefighters. This is one of several approaches that we're trying to implement, and I think it's going to be very effective. And I think personally, I believe this will help us to recruit firefighters statewide.
Follow up.
Thank you, Mr. Chairman. I thought that was one of the questions on your survey that you put out, that if this was offered, you would become a firefighter or something like that, because you have done surveys throughout the state, correct?
Mr. Cooper.
Mr. Chairman, Representative O'Hearn, no, that was not a specific question that was included in our statewide survey. The question is how many firefighters are you short on your roster?
Yeah, Senator Hutchins.
My question is to Mr. Hayes. Is it possible if one of the firefighters was to go through with this, could the insurance just cover them and not their family? Or is that just something that happens automatically? You enroll, the whole family gets in.
Mr. Hayes.
Mr. Chairman, members of the committee, the way that our system is set up, if you're an eligible employee by statute, that your eligible dependents are eligible to enroll on the particular plan, so they would be part of it. Now, I do want to point out, just to clarify a question that came out a minute ago, with as far as the only portion on is eligible for coverage under a government-sponsored healthcare program. Doesn't mention any other employer-sponsored plans. Now, I do realize that a lot of these individuals will have their own particular health insurance out there, which will reduce the enrollment. So it would be maybe self-employed individuals who might find it, again, on the older age categories, it might find it attractive, but we're definitely probably not going to get the 20-year-olds or 30-year-olds on this program.
But I'd be correct, we would know a year or two into the program, you could consolidate numbers or who you're.
Mr. Chairman, members of the committee, yes, in 2 or 3 years, my successor could look at the claims within the program and the premium collected and to see if there's a ratio that is out of line with the rest of our enrollment.
Okay. See if Representative Penn's going to put a sunset on this one. Representative Penn.
Thank you, Mr. Chairman. I actually was considering it, but that is not my question. So with regards to the premiums that we're discussing, so it looks like the intent is that the enrollee would pay the entire premium. Correct. So I'm just thinking, sometimes with employer plans, an employer pays a portion of the premium. And so people think that they're paying the premium, but they don't realize that they're only paying a portion of it. And so just to clarify, the state is not covering a portion, the enrollee would be paying the entire thing. And if they had dependents, also for the dependents.
Mr. Chairman, members of the committee, the bills clearly specify there's no employer contribution from the state to help in paying these premiums. For us, it's the participating entities, whoever they work for, are responsible for paying that employer contribution. And for all participating entities, we require a minimum of what the state pays. But this is a little bit, this is unique. And this amending statute to our program actually allows them to have zero employer contribution and pay 100% of it.
Follow up, yep.
Thank you, Mr. Chairman. Is there any estimate? I mean, I know premiums vary, but are we looking at premiums that are going to be, you know, $200 a month? Or are we looking at premiums that are going to be $1,500 a month on an individual?
Mr. Chairman, members of the committee, they brought them. This is helpful. For $900 deductible, the single and premium currently will be $1,051.68. A family is $2,436.40. Now we bump that to a $4,000 deductible. It goes to $889.05 for a single and $2,059.90 for family. So the rates are consistent across the board, no matter your age or job. In our program, you pay the same rate for the same benefit. It's not age rated.
Any other questions? Everybody good? All right. Any other public comment? Let me check online. Mr. Sweeney or Miss Momsen, either wish of you wish to testify on this bill? I'll give you a second. If you do, raise your hand. Not seeing either one of them jumping up. Anyone else in the room wish to testify on this? Not quite as full as we were this morning. All right, well, we'll close public comment. Committee, what is your pleasure on 24 LSO draft 26? It's not 26, it's 24. Moved by Yin. I know you were reaching for it. And we'll second it by Chadwick. All right, amendments, discussion. Starting with Urban Clouston.
Thank you, Mr. Chair. I'd like to put forth an amendment changing the 31 days to be more consistent with their other policies to eligible after 90 days.
Okay, the motion, and if you would, what's the citation? Give me the page and line number on that one, Urban Clouston, if you could.
It would be page 2, currently line 10. Talks about within the first 31 days of enactment of the section or within 31 days of initial volunteering as a firefighter.
And you wish to change both on the 90 or just when it goes into enactment, you have to wait the 90 days or just for any future voluntary firefighter?
I think 90 days after they are signed up as a volunteer firefighter, they would be eligible to participate.
So on both lines as well? So you'll have an existing class of firefighters volunteer when this bill becomes effective. Do you want them to wait 90 days or not? I guess is the question.
I think this would be new ones.
Okay, so just then on line 11, with anyone, is that okay with the second? Okay, discussion on that amendment. Representative Chadwick.
Thank you, Mr. Chairman. So what it currently says is within 31 days. So we want to wait after 90 days. Is that the way you want it to read? Okay. Thank you.
So usually when you sign up for a position, you have, it's called a qualifying event, and you have 31 days to enroll in insurance. I assume they would still have those 31 days after their 90 days to enroll. I'm looking for where Mr. Hayes went. Does that sound, I just want to make sure I'm not messing up anything with our federal laws or our requirements on when people can and come into health insurance. Could you comment on this amendment, Mr. Hayes?
Mr. Chairman, what we'd be attempting to do is have a 90-day waiting period before they're eligible for the program. Then the 31 days would apply as far as the application period once they meet that 90-day waiting period.
And so Ellis, so just making sure you can draft that up. This might not be the exact change of this to 91, but you understand the conceptual content. Okay, Senator Hutchins?
Mr. Chair, isn't there an enrollment period for health insurance or for the state? Is it any time?
Mr. Chairman,
Yes.
members of the committee, your initial enrollment period is when you come to work for the state and you have 31 days from your eligibility date to enroll in the coverage, which is what is said here. Then you can't, if you don't take it at that point in time, you have to wait for open enrollment period or have a family status change,
Qualifying.
event, thank you. So getting married, divorced, something along that line, which would change your eligibility for coverage, and then you could enroll in the state's plan.
Follow up, Mr. Hayes, when I asked the question about the family, you said the family is eligible to enroll, they're not automatically enrolled, so they have to enroll as well. Is that
Mr.
what you were saying?
Mr. Chairman, members of the committee, when you fill out the application, you fill out your own information as far as enrolling, and then you add on any dependents, their information that you would like to add them on. Now, yeah, I guess I'm going to get into a key point. I'm looking at this as dealing with the health and dental plan only, not the other benefits out there.
Which are, Mr. Chair?
Vision, I mean, so what would the other, we have a wide variety of benefits in state government. And if you want to mention a couple of them, go ahead, Mr.
Mr. Chairman, members of the committee, life insurance, first of all, and bringing in a group of potentially high-risk individuals being firefighters could actually skew the rates. The other thing would be the voluntary benefits, so vision, short-term disability, long-term disability, which really doesn't apply because they're not really employed in this particular case for compensation. And we also have the air ambulance benefit.
But for this, where it is just medical and dental for what we both assume according to those statutory citations. That sounded right, LSO? Just want to make sure. Okay. Further, Representative Hornock, is it a question or just discussion?
Yeah, kind of a question with that amendment. I like the amendment, but what happens to people who are already existing volunteer firefighters? Do they still have to wait the 90-day? Are they immediately eligible? Is it just 31 days? What do we do
So
there?
Representative Hornock, it sounded like with that kind of double check on the amendment, any current of this bill goes into effect would be able in that 31 days of the effective date of this bill, which I didn't look at what it is, but I assume it's next July. Oh, no, it's effective in subsection 3 and 4 necessary. You're right. Subsection B is effective July 1st. So those existing volunteer firefighters, Mr. Hayes can correct me if I'm wrong, would be eligible for that 31-day period. But anybody who joined the volunteer firefighting after that, if this amendment passes, would wait that 90 days.
Mr. Chairman, members of the committee, that is correct. So anybody who is already an existing firefighter are eligible to enroll without the waiting period. The waiting period would be strictly for new volunteer firefighters.
So it would be interesting if they enrolled on June 30th. They wouldn't have to wait that 90 days. Right? I mean, that's how I read it. Correct? Yeah. Okay, further discussion on the amendment. Seeing none, all in favor of the amendment, say aye.
Aye.
Opposed, say no. That amendment's passed. Back to the bill. Senator Baldwin.
I would like to propose an amendment in no specific line right now, but that would just be to add volunteer EMTs and volunteer search and rescue to the bill as we have in the retirement program. And just conform that anywhere in the bill at several places.
So primarily LSO on page 5, line 9, it would be a volunteer firefighter and then a volunteer EMS or volunteer search and rescue with the appropriate citations. Want to make sure we believe that's doable, Anna. Okay, and seconded by Yin. Discussion on that, Representative Hornock.
Thank you, Mr. Chairman. I understand that the volunteer firefighters are under the umbrella of the state. I just want to make sure that the search and rescue also is under the same umbrella, or I know in other places, they might be not necessarily under the state umbrella, or, you know, just want a little more clarification as far as where they land in what they're doing.
We give them civil immunity. Senator Baldwin, where
Yeah.
else?
And they all fall under the same workman's comp program. And in this case, we're talking about those that are voluntary and not those that are full-time employees of, say, a hospital. This is just the volunteers who may or may not have employment somewhere else that don't have insurance coverage. So as far as I think, otherwise they fall completely under the same umbrella as emergency workers, as all the other emergency workers in the state.
Senator Baldwin, if you know, if you're on search and rescue, do you have to have any certified credentialed training? Like you would for a paramedic or assumedly firefighters have some certification to be a volunteer firefighter.
I am not on search and rescues. I have not found a time in my schedule, but I will tell you, yes, they do have certification requirements as well.
Representative Yen.
Mr. Chairman, I do know for a fact that the Teton County Search and Rescue operates under the county sheriff's department. I believe that's the case for other search and rescue organizations. I don't know for sure for all of them. I do know that there is a statutory definition for it somewhere in statute. But many of them are under the state through the county's sheriff's department.
Senator Hutchins. We believe there's authority there. Other discussion of this amendment? I guess I just personally said this is a big step. That's some even bigger step. And I don't know if we have the numbers today on how many volunteer EMS or search and rescues, and if they would have these same requirements. Hi, Anna, go ahead.
I have the number for EMTs if you want it. There's apparently 311.
311. Search and rescue off the top of your head?
That will be a smaller number. I don't know the number, but it will be a smaller number. There's not as many groups.
But would they have similar requirements where they have to be on and 25% of the?
They do because they're already under the pension program, so they have the same
Yeah.
requirements. Same reporting, same audit requirements.
And Mr. Chair, we can double check, but most fly under the sheriff's office because that's who gives the order to dispatch.
Okay. Representative Yen.
And Mr. Chairman, the one thing I would note is that if we don't have it as an amendment here, it'd be really difficult to do it as an amendment during the session because the title of the bill is specific to volunteer firefighters as it is now. So we'd have to amend it in committee, otherwise it would need to be a new bill.
And it would be an interesting fiscal note to try to amend it on the fly. I would assume Mr. Hayes, is he still here? Oh, you don't have to come back. I mean, you probably, there's the same four of you. If you want to sit in the first couple chairs, that'd be great. But if this amendment did pass when the budget, but the fiscal note came in, you could break it down most likely by firefighter, EMS and search and rescue. Would that be correct? So we would have those numbers ready to look at during session.
Mr. Chambers, members of the committee, really, from our standpoint, it doesn't matter. Because we can't really figure out a fiscal impact anyway. It's all going to be dependent on who chooses to enroll in the program or not. It's just an eligibility issue. So I don't see technically the need for a budget impact to have separate bills for this.
But we can maybe track age. I mean, if what I'm thinking and you're saying is probably true, it would be some of the, it would not be your young, healthy 20 to 24-year-olds. It may have the other people in their 40s and 50s who would have more care needs, shall we say, assumedly, but you would track all that and be able to give us numbers after 2 or 3 years.
Mr. Chairman, members of the committee, once we have enrollment figures, yes, at that point in time, we can track what's going on with the program, the where they're located, the age categories, single family status, not by zip code, because of course that would be HIPAA related information, but we could give general information on the results of enrollment over a period of time.
And maybe by county at least, probably. Is that too close?
Mr. Chairman, that might be getting us into the HIPAA issue because you can start identifying who's enrolled in the health plans. Just being enrolled in the plan is protected health information. So we might not be able to do by county. We might be able to do it by region, maybe divide the state into quarters or something like that. But we got to be very careful with HIPAA privacy.
Okay, Mr. Matthews, anything? All right, further discussion on this amendment, Representative Hornock, then we'll go back to Senator Baldwin. Great.
Thank you, Mr. Chairman. We've heard a lot about the need for volunteer firefighters, more firefighters. We haven't necessarily, this is kind of a new thing. We haven't necessarily heard of the need for the search and rescue. I'm sure there is the need, but we've been talking for, 3 meetings now about the need for volunteer firefighters. I don't want to hamstring necessarily that bill. So I'm curious how big that need is. I don't think I mind the idea. Those guys are rock stars and so are the firefighters, but they're a necessary service, but we haven't heard about the need. I'm curious about that.
Senator Baldwin.
Actually, Mr. Chairman, we did discuss that very issue on the first time we brought this bill up. We discussed the volunteer EMTs and we did discuss, I don't know if our gentleman is here with us today, but we did discuss that issue completely. There's a tremendous shortage of both search and rescue and EMTs volunteers. And we discussed that number some numbers, and I don't remember the numbers off the top of my head, but there's a significant need. And the point that I was going to bring up here is the numbers that we're talking about, Mr. Hayes. I don't think we're going to know a lot because a lot of these people we're talking with, we were using this as a recruitment tool. And the firefighters, EMTs, search and rescue right now may not be necessarily the ones that are going to sign up for this. There may be some, but our hope is that this is a recruitment tool and that will bring some people in that otherwise would not have signed up to be a volunteer fire EMS or whatever. And we're going to bring them in and that it'll be a moving target. It'll be something that we add to over time. But I would anticipate that initially there's not going to be a very large number because we're using this as a recruitment tool. And that is the genesis of this bill, is we need a recruitment tool to try to bring these people into a service, volunteers and everything, not just these services, but volunteers are suffering. We can't get them. So it's going to be something that's going to change over time, but I would suspect that initially the number is going to be fairly low.
And Committee Representative Yin did just send you information on the retirement system for volunteer firefighter EMTs and search and rescue. So they are lumped in together. And I assume we wouldn't want somebody who's an EMT volunteer to go say, well, I'm going to go be a volunteer firefighter, not an EMT or search and rescue because I can get insurance. Certainly probably don't want any intra issues. Any other questions on the amendment discussion? Seeing none, all in favor of the amendment to add in EMTs and search and rescue into the bill, say aye.
Aye.
Opposed, say no. That's passed. Back in the bill. Any more discussion on amendments committee? Seeing none and question being called. Katie, if you would call the roll on 24 LSO 24 to make it a 2024 House bill.
Mr. Chairman, this is roll call for 24 LSO 0024 as amended, health insurance for volunteer firefighters, as amended. Senator Barlow. Senator Bouchard. Senator Dockstader. Senator Hutchings.
Aye.
Representative Chadwick.
Aye.
Representative Klauston.
Aye.
Representative Hornock.
Aye.
Representative O'Hearn.
Aye.
Representative Penn.
Aye.
Representative Trujillo.
Aye.
Representative Ward.
Aye.
Representative Yin.
Aye.
Co-Chairman Baldwin. Chairman Swanser. 12 aye, 2 excused.
I'm just excited to have unanimous votes in this committee. I wasn't going to stop that one. I know. Next up, we have firefighters recruitment film 24 LSO 26. Mr. Hayes doesn't want to talk about that one, I suppose, but Mr. Matthews, I bet does. Certainly can have LSO talk about what it does, but it's pretty self-explanatory. They want to make a film with an unknown appropriation currently. They can't be more than 20 minutes long. Mr. Matthews, welcome. Talk about this idea for us.
Mr. Chairman, members of the committee, Byron Matthews, Wyoming State Fire Marshal. Yes, we talked about this last time we gathered. I believe we were in Evanston. And we had some discussion to the extent of the appropriation and working with our friends at Workforce Services. That number provided to our agency is $150,000. So with that, I can answer questions or walk through as we go, but that's what I know today.
You didn't happen to put it in your budget to the executive branches and ask, did you?
I actually, Mr. Chairman, did ask through the executive branch, and I was provided the education that it would be best if this body so chooses to move this piece of legislation forward, they include the appropriation for the agency.
Senator Hutchins, questions?
Yes, Mr. Chair, I was thinking last night about the film industry fund that they have in travel, recreation, and wildlife. Would this be something that would fall in that category?
Senator Hutchins, only if you wanted a major motion picture, I suppose, but
I don't
mean,
know.
it certainly
I'm
could.
just-
Mr. Matthews, are you familiar with
It's a 20-minute.
Fifi?
Yeah.
Would this apply?
Familiar, not able to answer the question.
Unknown.
Just a thought. Thank you.
If we had a of state production crew come in and did some exciting firefighter training on pristine places, you never know. Representative Hornock.
Thank you, Mr. Chairman. There's been discussion that potentially there's bringing there will be a budget item with the $5 million for stuff that the governor's office talked about. Would this be able to fit within that budget, or is there some discretionary funds then within that budget that you'd be able to use and work with that, or do we have to do this kind of appropriation in this bill?
Go ahead.
Mr. Chairman, Representative Hornock. As I understand the discussion that came out of the EMS work group, that 5 million was proposed for the EMS. This would be a separate appropriation to allow us to create that recruitment and use the marketing firm to get that out to the right audience.
Have we done any research on the number that we were hoping to put in here? I don't know if you suggested a number in the executive budget talks, but I think it's probably time. Do you have a number in mind you'd be asking for?
I think that based on our friends at Workforce Services, Mr. Chairman, that 150,000 was the number that we were given.
Okay. Those are your friends, huh? Senator Hutchins.
Another thought. Young kids in high school in the theater program, have you thought about approaching someone there to possibly put together a film for you for free and get it out to your targeted audience?
Mr. Chairman, Senator Hutchins, the conversation, we could certainly pursue that option. That is not a conversation that has come to fruition. And one of the other conversations that was had based on this was making sure that we market it through the right means and to the right audience. So one of those discussions is using those funds to make sure that that firm is assisting us, making sure we're hitting the right group. I'm not into that group or the social media, ensuring that we're getting to the right group. As we talked about earlier, bringing the younger members in, making sure that the content that we're using appeals to that audience is not my strong suit. So I would need help there, I guess is what I'm trying to say.
Gotcha.
Further questions? Seeing none. Anyone else want to testify on this bill? Let me check the Zoom room just in case. Not seeing anything. Anybody in the audience? Seeing none. We'll close public comment. Insurance hospitals, you're good? Okay. Committee, what's your pleasure on 24 LSO 26? Moved by Senator or Representative Chadwick, seconded by Senator Baldwin. Discussion, amendments. Senator Baldwin.
Thank you, Mr. Chairman. I would move on that page. I don't know the page 2, line 8, that we appropriate $150,000 and replace all those X's.
Okay, is there a second? Seconded by O'Hearn. Discussion. Oh, did you second it, Representative Chadwick? Sorry. seconded by Representative Chadwick. Any discussion on putting in the $150,000 number? Seeing none, all in favor of that amendment, say aye.
Aye.
All opposed, say no. Okay, that amendment's passed. Other amendments or discussion? Senator Baldwin, anything?
No. Forget my life.
Question being called. Katie, if you would call the roll on 24 LSO 26 to make it a committee bill for the 2024 session.
Mr. Chairman, roll call for 24 LSO 0026 firefighters recruitment film as amended. Senator Barlow. Senator Bouchard. Senator Dockstetter. Senator Hutchings.
No.
Representative Chadwick. Representative Clauston.
Aye.
Representative Hornock.
No.
Representative O'Hearn.
Aye.
Representative Penn.
No.
Representative Trujillo.
No.
Representative Ward.
No.
Representative Yin.
Aye.
Co-chairman Baldwin. Chairman Swanitzer.
Oh, I'm.
7 aye, 5 no, 2 excused.
Okay, that will be a Senate file. Anything else from the firefighters, EMS, anything else on this topic? Seeing none, certainly appreciate all 3 meetings and a lot of work that went into, was it 6 bills that I think are coming to the 2024 session in regard to these issues. So hopefully moving Wyoming forward and maybe some more money coming from the executive branch. And yeah, it's nice to move Wyoming forward little by little.
We expect 500 volunteers next month.
We look forward to to some numbers and helping rural Wyoming. Yep. Thank you. Committee, anybody need a break? We're good to keep going? Okay. We're gonna jump right into the next topic on our agenda, which is Youth Tobacco Cessation programs. You'll remember this was a vote from the July committee on putting this bill forward based on some things that were happening in Natrona County. I don't know, Anna, do you want to, Katie, welcome, Miss Adams. If you'd quickly run over the draft, I know it'll be short, but if you'd provide us the intro.
Thank you, Chairman Swanitzer, members of the committee. Katie Adams, LSO. This is 24 LSO 150, working draft .4, minor consent to tobacco cessation treatment repeal. This act just repeals section 14.1.101(b)(6). That section provides a minor who is 12 years of age or older the ability to consent to tobacco cessation treatment to the same extent as if they were an adult. In other words, they wouldn't need parental consent for that. And you did receive a memo related to this issue. And with that, I would stand for any questions.
Any questions from Ms. Adams? Not seeing any. Must be a good intro. People in favor of the bill, I don't know, Representative Ward, do you want to kick us off?
Thank you, Mr. Chairman. I just wanted to remind our committee why this became a thing, if you will. And that was because one of my constituents, and this has happened a couple of times across the state, contacted me to say they could no longer access their online 12-year-old's medical records. To be clear, my philosophy is that there are no medical records of a 12-year-old that should be hidden from parents. This is one of the reasons that was happening, and hence the proposal to repeal this statute. And I am not suggesting that we repeal the part that says that a tobacco cessation program be implemented and developed. I am merely suggesting, which is what this does, that we repeal the part that says that a minor of 12 years old can consent to tobacco cessation without their parents' knowledge.
Any discussion from the board? Not seeing any.
I would like to add, Mr. Chairman.
Go ahead.
If possible. So from LSO's memo, there are other reasons why minor health records might be hidden. In the course of their memo, they cited Wyoming Statute 35-4-113 BI, which states that if it's during a public health emergency, the state health officer may subject a person to vaccination or medical treatment without consent in the following circumstances. And this is the I part. If the parent, legal guardian, or other adult person authorized to consent to medical treatment of a minor child cannot be located and consulted, and the vaccination of or medical treatment for the minor child is reasonably needed to protect the public health or protect the minor child from disease, health, disability, or suffering. I would like to suggest that our committee take up repealing that statute, because I don't think it's right that a minor child can be vaccinated without their parents' knowledge or consent, particularly during a public health emergency such as we saw recently. I don't think this should be happening.
And Ella, so because we're still in the interim, technically we could kind of conglomerate multiple issues into this bill. We'd have to change the title, but at this point, that would be a possibility if we were to expand this bill to not just be smoking cessation. I guess my question is, are those concepts too far apart to put in one bill draft? Because our concern is we won't probably have another meeting of this committee. And so to have another bill, we would have to have another meeting. So my question is it amendable into this bill draft that was publicly noticed? Or would it just be an individual bill during session? Not that that motion's even been made yet. I just kind of checking before we pursue that line if there is a way to kind of have a broader umbrella topic in your estimation. And you can talk about it for a little bit. Are there other questions on that, Representative Penn?
I guess on the discussion that was just occurring with LSO, I might say the link here would be parental rights and minor healthcare choices.
Mr. Chairman, I think it is debatable, and I think that is one way you could go with it.
And expand it to parental rights for minor health care. Okay. Sounds like it might be in game. Keep going, Representative Ward.
So I make a motion that would happen.
So we would need to move the bill after public comment, and then at
Okay.
that time, I will call on you first.
Okay, thank you.
Okay. Other comments on the bill as presented right now? Or anything else? I know LSO did provide a memo to the committee. We did not put that on the internet for the public because it's generally a privileged and confidential memo. But certainly members of this committee are fine sending that out should anybody request a copy of that. But it is all of the areas of Wyoming law and some federal law that there are stipulations when it comes to what minors can consent to without parents, and in some cases are emancipated. There are other federal, there's a myriad of federal laws and state laws that can affect treatment for a wide variety of items, and what we can allow certain age groups, specifically older teens, to consent to without parental permission is what the memo is about, if anybody's watching online. Yep, Representative Ward.
I forgot the exact details, but one of those is in court right now in Texas, and Texas ruled in favor of parental rights, if I am not mistaken. So I'm not suggesting we bring that up in our committee, but just so that the committee is aware that these rules are subject of national conversation right now.
Representative Penn.
Thank you, Mr. Chairman. I guess I would just add my support for this bill and further discussion on how this is applicable in Wyoming. This statute, as Representative Ward indicated, was used because of the age portion of this. They were saying this is at 12 years old, then parents lose access to their child's online health information. It was used as a blanket for all access to all information at the age of 12. And so I guess that's specifically pertinent. I mean, the tobacco cessation is really a side note here. It's that this at this age has been pointed to as the reason why they can't provide parents access any longer at age 12.
And just to clarify, that is the online, you're still available as a parent to go into a healthcare center and do a written request, from what I understand. And they're entitled to any of your minor's health information. It's just not available on the electronic portal, and we've gotten really used to having all of our information at our fingertips. So it is still accessible, but it's not in the online portal, and you would have to go make the official written request under HIPAA. All right, other Representative Trujillo. Hi.
Thank you, Mr. Chair. I just want to make a comment on the online access. Wyoming is a rural community. And we don't always have access to drive 150 miles to our doctor or hospital to get access our 12-year-olds' records. So having access online in Wyoming is a big benefit.
Are there any other comments before we start doing public comment? Representative Penn.
I guess I could wait to the end, but to add to Representative Trujillo, not just the fact that we are rural, but also the fact that all healthcare is being pushed in the direction of all electronic, and paper is really discouraged. So it is additional because of the rural nature and the distance that someone might have to travel, but also people are simply just encouraged to do everything online these days. And so there may be situations where a parent may attempt to do such things, and they may be then still referred to online, which would be restricted.
Okay, let's take some, Reverend Claston, public comment on nicotine cessation. Mr. Boley from the hospitals, welcome. Floor is yours.
Thank you, Mr. Chairman, committee members, Eric Boley with Wyoming Hospital Association. We actually provided a memo. I think they just passed it around to you. We did the research, and we appreciate the sponsor of this bill giving us a chance to do the research. And we also provided what's happening right now on Title 10 in Texas, the case that Representative Ward talked about. And that one's federally mandated as far as that being for family planning situations for minors. We don't oppose the repeal at all. I do want to clarify, we feel strongly that parents should be involved in their children's healthcare. There are limitations to some of our electronic health records, which is what brought this forward. And even if you do repeal this, there may be situations until those systems are upgraded or changed, where there still may be limited access from an electronic perspective. But as Chairman Zwanitzer noted, there is always access to those medical records by going and receiving a hard copy. We also gave you a list of all of the other conditions that a minor may be able to receive treatment for without parental consent. It's 2 columns on 1 page, just for you to consider. And those are conditions or diagnoses that have been identified by the Department of Health. We also provided information about HIPAA privacy rules, and honestly, this smoking cessation is a state rule, and so if it is repealed, there's not a HIPAA violation. We don't have to worry about federal law as far as this one is concerned, nor do we have to worry about, to my knowledge, the vaccine for COVID. One thing to consider, though, we focus heavily on the pandemic that we just came through and focus on COVID. I would just urge a little bit of caution. Who knows what we're going to face in the future, and if we have an outbreak of smallpox or something else where vaccines may make sense. But again, who knows what the future holds. But with that, I'd answer any questions. Thanks.
So because you all know I work at a hospital, I know we have this capability. Even if there's not an online portal to access those medical records, can you still request your child's medical records in an online fashion, maybe pay a fee and have those sent in the mail? There's still that availability to ask online. You just can't view them, from what I understand, online, at least for this one hospital in the middle of the state.
Mr. Chairman, you're making me go back to my days in Kimmer. I'm pretty sure that you can sign an authorization form and have those have a copy sent to you. The actual physical copy maintains in the custody of the the caregiver, whoever, the provider, but you can always get a copy of that. You can go in person and sit down in a room and go through the permanent record. You're not allowed to take it out of wherever it is stored, but getting an actual copy of that, I believe you can do either an online fax or a phone call, but I do believe it requires a signature if I remember right.
Other questions to the hospital, Representative Ward?
Thank you, Mr. Chairman. Mr. Bully, I just want to clarify that the second suggested repealer I made was that minors cannot be vaccinated without their parents' knowledge. Now, I might have feelings about vaccination, but that's not what I'm suggesting here. I'm saying minors, we need to repeal the part that allows minors to be vaccinated without their parents' knowledge. Certainly, you wouldn't have a problem with that, right?
Does the hospital association have a position on vaccination of minors?
Mr. Chairman, we obviously follow the guidance and scientific evidence. We're going to adhere to whatever the legislature directs us to do.
Other questions for the hospital association? Seeing none. Thank you much.
Thank you.
Blue Cross Blue Shield, any public comment? Let me check online. 3 of you in the waiting room. Department of Health, Representative Sweeney. Anybody wish to comment on this bill? Not seeing any. All right, we will close public comment. Committee, what is your pleasure on 24 LSO 150? Moved by Representative Ward, seconded by Representative O'Hearn. All right. Discussion, amendments, thoughts. Representative Ward, go ahead.
Thank you, Mr. Chairman. I move the amendment we discussed earlier, the repealer of vaccinating minors for COVID without parental consent, as detailed in Wyoming Statute 35-4-113BI.
Seconded by Senator Dockstader. Let me check with Ms. Adams to make sure, is that an easy repealer? Where would it go? Do you have that on the fly? Okay.
Chairman Wanitzer, we would just add that to the same line where we're repealing the one on tobacco cessation. We would repeal both of those statutes and then change the title, the catch title.
Okay.
And make conforming amendments.
Senator Hutchings, discussion?
I was,
Is that true? Your mic's on. Okay. Other discussion on this amendment?
Question.
Saying not, Representative Penn.
Thank you, Chairman Wanitzer.
You're welcome.
I think that this is very appropriate. I don't think whether current accepted scientific knowledge at the time says that you should be forced to do something against your will, or your child should be, because it says without consent, that the public health, that they can be vaccinated without consent. I don't think that in any situation that should ever be allowed in this liberty loving free country that we currently find ourselves. As we have seen in the last couple of years, and as we have seen in the previous many decades, that science is bound to change. And the definition of science means that things will evolve and change, and to submit somebody to something that has the potential to cause them harm against their will is never okay.
So on the opposite end of that coin, I'm a 17-year-old. I want to play on the high school golf team. There's a public health emergency. The school district says, hey, I have to be vaccinated. My parents say, heck no. But as a 16 or 17-year-old, I say I consent to the vaccine. The belief would still be, if the parent says no, that child shall not get a vaccine. Representative Yin, thoughts?
So, Mr. Chairman, that the specific section is about involuntary vaccination for anybody. And then the subsection that's being repealed is specific to children without their parents' consent. So this is an emergency power that wasn't used in the public health emergency, which is involuntary vaccinations by the state. So even in that situation, it wouldn't fall under that section because it wouldn't be involuntary to the child either. Which again, wasn't a power exercised by the state. That whole section wasn't exercised by the state. I'll probably oppose the amendment just because there may be an emergency where we need that power. And I don't want to remove that power if it's necessary for the public good. For example, if it's an Ebola outbreak or something crazy like that, where we would need to actually truly vaccinate everyone. Otherwise, a lot of people would die very quickly. So again, that's why I'll oppose it, but it isn't a power that was used in the public health emergency.
Okay. Further discussion on the amendment, Representative Warnock.
Mr. Chairman, as far as the title, then what are we looking at? I'd like to just propose something like medical records of minors repeal or something fairly simple.
I think it was slightly broader. Representative Penn had what I thought was a pretty solid overview. Do you remember what you mentioned?
I think I had said parental rights in minor healthcare choices.
LSO, you got that down? That sounds acceptable. So as part of the amendment, we would change the overall title of the bill to reflect multiple repealer sections. Okay, further discussion on the amendment. Seeing none, question been called. All in favor of the amendment, say aye. Opposed, say no. Okay, that amendment passes. Back on the bill. Further discussion, amendments, Representative Yin.
I'm just gonna say, I am gonna vote against it, not just for that part, but because of the tobacco cessation part. There is a public health benefit to allowing that, and that is to get kids off of tobacco. And if it will end up, what I imagine happening is that it'll end up preventing kids from actually trying to stop using tobacco, and that would be a negative public health benefit. So again, that'll be the reason I vote against the bill, but I probably will be the only one. So thank you, Mr. Chairman.
Any other discussion or amendments, committee? Seeing none and question being called somewhere. Katie, if you'd call the roll on 20 for LSO 150 for committee bill for the 2024 session.
Mr. Chairman, roll call for 24 LSO 0150 minor consent to tobacco cessation treatment repeal as amended. Senator Barlow. Senator Bouchard. Senator Dockstetter. Senator Hutchings.
Aye.
Representative Chadwick. Representative Fausten.
Aye.
Representative Hornock.
Aye.
Representative O'Hearn.
Aye.
Representative Penn.
Aye.
Representative Trujillo.
Aye.
Representative Ward.
Aye.
Representative Yin.
No.
Co-Chairman Baldwin. Chairman Swanser. Are there any changes? 11 aye, 1 no, 2 excused.
All right, committee, we're at the section of public comment. Should there be anything else out in the universe? Let me check the online Zoom as well. If any public comment online, anyone here in the audience wishes to address the Labor Health Social Services Committee on any issue. So committee, barring anything that comes out of nowhere, this will be our last committee for the 2023 interim. I hope you've all enjoyed it as much as I have. But we'll look forward to seeing you all in February again. And I don't know, Ms. Johnson or Ms. Adams, do you have a list of all of the committee bills total this committee will be bringing readily available?
Not readily available, I'm sorry.
Okay. But for those of you who are new to the process, your co-chairman and I will probably in November, December, sit down and divvy up bills between the House and the Senate. We generally try to ensure there's a fair number going to each body and usually like-minded bills. So probably one of us will take all of the EMT firefighters and the other will take all the insurance, something to that effect. And those of you new to the process, the 2024 budget session, everything does need a 2/3 introduction threshold, which is increasingly difficult to meet. And in some years, we have had committee bills kind of be agreed upon that they will pass through. Other years we have not, so that remains to be seen. Any closing out comments from the committee from this past interim? Otherwise, it is kind of a long time till February, but it'll be here before you know it. Senator Hutchins.
About comments, I'm really pleased with Saratoga, very appreciative of the hospitality, the things I've seen, the friendliness of the people. it was a wonderful choice. Thank you.
And I think, yeah, committee, I would look forward to coming back here. The restaurants were good. The building is very well set up. The hospital here, I thought it was an all-around great, enjoyable committee meeting, and corporations used to come here every year, but Labor Health hasn't in a while. So we'll keep it on our list of ideas next year. I do think we will probably go to Kemmerer to view some things for Labor Health, and maybe go to Laramie to look at the health science school. Those will be 2 of our 3 places. With that, anybody else? Representative Hornock?
Thank you, Mr. Chairman. Just a comment. I know that we're called the Labor Health Committee. We've dealt with a lot of health issues, which is fine. I would ask, we did have some topics that were proposed dealing with more of the labor side, unemployment, labor issues, that kind of thing. It would be nice to have some discussion over that. Our unemployment rates have risen in Wyoming. It hurts employers. Costs go up. So we do need to deal with some of that stuff. I asked that the committee would consider that stuff in the future. Thank you.
With that, have a safe drive home and an enjoyable Friday evening, and we'll see y'all in February of 2024. We are adjourned.